Holy Cross Hospital brings you House Calls, a community education program presented by the physicians on staff at Holy Cross Hospital. This program furthers the commitment of the Sisters of Mercy to provide quality medical education while fulfilling their healthcare ministry.
Hello and welcome to House Calls. I'm Maria Saldani and I welcome you to this program today, which is very special because we're going to talk about shingles, a topic that everybody wants to know more about. And our guest speaker is none other than Dr. Andy Mencia. Welcome, Dr. Mencia.
Thank you, Maria. Good to be here with you.
Good. And did you know that Dr. Mencia is a gerontologist? So let's begin the program by identifying what a gerontologist is. Dr. Mencia, could you tell us what it is?
Sure. A gerontologist is a physician or a PhD that specializes in the normal process of aging. And then when we go into geriatric medicine, that is the physician that now study and identify and treat the diseases that are common in the elderly patients.
Right.
One of our main functions as a gerontologist is that regardless of a person's age,
right,
our main job is to make sure that the person have excellent quality of life. And as a gerontologist or a geriatrician, we make sure that even during the dying process,
right,
that the person's dignity is maintained.
That's wonderful for us to know, but also because so often as we age, we have so many different doctors managing our care,
Absolutely.
and it's great to have a gerontologist that sort of stays on top of all these specialists and assumes the position of the driver of the bus.
Right,
so
the quarterback.
There you go.
Quarterback.
That's another way to define it. Well,
Yeah.
thank you for being here and making that clear to our audience. Now, they wanted to hear about shingles. And I know that that's something that we hear a lot about, but nobody really knows how to define it. So what is shingles?
It's a very interesting topic, first of all.
Okay.
Mainly because, hopefully before the program is over today, we're going to talk about the complications of shingle also, which can be devastating, especially in the elderly population. But shingle can be defined in layman terms as a acute dermatological process that will have a tendency to stay localized on one side of the body. It will never cross both sides of the body. And it will have limitation on what we call dermatomes. Dermatomes are nothing but the sensory component of a nerve. And usually it's limited to that area.
So this is a problem of the skin. That's the way
Exactly.
that I'm hearing you express it. And so therefore it presents itself and it becomes itchy. Does it become painful?
That's a very good question because not all shingle will have a rash.
Really?
Absolutely.
Okay.
There are patients that will have the itchiness, malaise, fever, headaches,
Right.
without the rash. The key for the person to recognize, what you need to recognize is that if you get the itching on one side of your face, and it's very localized so that you can even draw it with a pen, the area of that is itching you, that is bothering you, even if you don't have a rash, you have to see a doctor immediately. And immediately, I mean within 48 hours.
I see. So if you have a heightened sensitivity to an area that you can actually pinpoint, you should see a doctor about it anyway because it could be the beginning of a process.
Absolutely.
And the sooner you begin to take care of that disease, the better it is. What causes shingles? What are some of the causes?
Well, mainly when we are younger, especially during the age 5 to 10, that bracket,
Right.
We get chicken pox.
Right.
Very common.
Right.
It's very contagious, such that 90% of the susceptible person that get exposed to chicken pox will develop the disease.
Okay.
So it's very common. Once you get chicken pox, it's a process that will go away by itself.
Right.
Just symptomatic treatment for the rash. It's a generalized rash now.
Right.
It's not a localized rash. That's one main difference.
Right.
It will go away, but the virus now go to the ganglia on the back,
I see.
the sensory ganglia. You have sensory and motor. Motor is for the movement of the muscle. Sensory is the nerve that innervate all our body so that when you have a mosquito, let's say, that go on the dorsal of my hand, without looking, I know that something is right here and I can just tap on it.
Right.
So that area, that part of our central nervous system,
Right.
in the back, close to the spinal cord, the virus go there and stay latent for the rest of our life.
Okay.
And then what happens, right, then what happens is if our immune system, and this is very key here, if our immune system drop for whatever reason, name it you develop a cancer, if they give you radiation therapy in one area localized that will also include that area on your back, then the viral can be reactivated.
I see.
So anything that will drop the immune system, including being severely depressed.
Really?
Absolutely, including being severely depressed. So a person that is happy, that is content, that
Like
take
us.
care, like us, that take care of their body, they have less of a chance of having this recurrency. Once you develop a recurrency, you're still prone to more episodes to happen down the road. One of the risks is old age. That's why it's so important to have the topic being discussed with a gerontologist or a geriatrician,
Right.
because we see shingle a lot. And there are many, many times that I get patients that come to me. As a matter of fact, after the lecture we gave, I have one of the ladies that came to see me.
Right.
Her son is a doctor, so I told her to go and discuss it with her son.
Right.
I think they live in Connecticut or New Jersey, one of those two states. When she came to me, she had no sensation
Oh my.
on the cornea on the eye,
Right.
on that side.
Right.
So one of the complications that she had developed now is that she had this chronic problem in her eye, like she had dirt
Oh.
day and night. So it's
Right.
it can be devastating, the complications.
Right.
So that's why it's so important. If you go to see a doctor and you feel there is shingle, and you feel that the doctor is not too sure of what he or she is doing with you, you are the consumer. And Maria will tell you, I always tell my patient, you are the consumer, go and check with somebody else. You know, you always have the right to a second opinion. It's one of the rights that we inherit as a patient. Go and see somebody else just to make sure that they are doing the right thing for you so that we can prevent the complication.
Right.
Of
And
shingle.
that we can take care of it right away by the proper treatment. Now, let me go back and recap that. So, we all are exposed to chickenpox when we're children, and sometimes after our exposure, the virus itself retrieves by our spine, and somehow or other it affects our sensitivity, the sensors, and sometimes because we're stressed, sometimes because our immune system is overtaxed by being tired or depressed or just having some major diseases, then it can release that virus again.
Exactly.
And it appears then as shingles as opposed to chickenpox.
Exactly.
But it's very painful. It can be treated, but the sooner you treat it and address it, the better your chances are to recover.
Absolutely.
I got that
Absolutely.
right?
Now, you got it right. Now, a lot of people, they know of shingle on the chest wall
Right.
or the abdomen,
Right.
because it's very classical. You get a rash in a vein form coming down. It's on one side. Most
Right.
people recognize that. What they tend to neglect is when they have a syndrome called the Ramsay-Hunt syndrome,
Right.
which is the ear canal.
Something
And-
they can't see.
Right, and
Right.
this little area of the ear called the pinna of the ear,
Right.
the ear canal, and that you might get a Bell palsy, meaning that you have part of your face paralyzed, and you get a droop on one side of your face.
Right.
Those patients, especially the elderly,
Right.
are the ones that will end up with hearing loss on that side
I see.
and a vertigo or dizziness for the
Right.
rest of their life as a complication if they don't get treatment immediately.
So I heard of two things that are very important. Anywhere in the face, because it can affect your eyesight and it can affect your hearing.
It can affect your hearing immediately.
And your balance.
Absolutely.
So it is crucial that if you have any questions about this disease, you seek medical care immediately.
Immediately.
Now, you talked about causes, and you mentioned several complications, but I'm sure that there are more complications, and I know that we
Absolutely.
will be talking to an
Yeah.
ophthalmologist that works with you in addressing the disease. But what about treatment modalities? What do I do? Okay, so maybe I'm not sure and I want to put some Benadryl cream on it or something. How do you talk me out of it?
Yeah, well, Benadryl, which is what most people use out there, they get a
For
little
itching,
rash,
yes.
and I have one patient. Hopefully, I will talk him into coming to the show,
Good.
so we can film him because he just had the disease.
Right.
he came in and he had the rash in the back of his leg. Now, the back of the leg, you don't see the bird shape rash that we talk about.
Right.
So you see a little round area. So he saw that. He never thought of shingle, and he just went through this problem with his wife.
Right.
But she had it in the chest, so he said something else.
That brings a good point. Is it? Can you catch it from somebody?
That's a good question.
Woohoo!
If you have chicken pox, it's definitely contagious, and it's contagious through the droplets from the respiratory tract, upper respiratory tract. If you have shingle, you want to stay away from any pregnant woman or kids that have not been exposed to the disease. Right? Kids, all adults. If you have never been exposed to chicken pox, you want to keep those people away. So grandma, grandpa, if you develop this disease, the last thing you want to call is your daughter who is pregnant to take you to see the doctor, because then you are exposing other people. You want to call the doctor, let them know what you have, and if you can have private transportation, bring you to the doctor. When you are in the waiting room, let the receptionist know.
So that they can isolate you from the other
isolate you, put you
patients.
right into the room.
Right.
This might be an easy way for you not to wait for 2 hours to see your doctor. Okay, can get you in.
You're getting all kind of tips here today.
Those are freebies.
That's good.
But definitely it can be contagious to
So
people
my
that have not
husband
been.
can give it to me, and I can give it to my husband.
Right, if you
by
have
being
not had
exposed.
chicken pox, right.
But
you
if
have,
I had chicken pox, then
if
I'm
you have
immune.
chicken pox, you can touch the rash and everything, and nothing will happen
So how
to
did
you.
this gentleman get it? The one behind the leg. It had nothing to do with his
It
wife.
just reactivated on
Okay.
him. He was going through a lot of stress,
Okay.
and hopefully we can get him on the show.
Okay.
But he was going through a lot of stress, taking care of his wife, and then he developed the rash.
And he could not see it because it was behind his leg. Now, you've mentioned 3 locations
And
right
he
now.
will tell you that when he came in to bring his wife,
Right.
and on the way out he said, "By the way, Dr. Mencia, I don't mean to bother you, but will you take a look at this?"
So he wasn't even taking care of himself then.
He didn't think of shingle at all.
Right.
So that way
Right.
it would be an excellent case to come in
Excellent.
and have him talk a
Excellent.
little bit. Okay, so we are seeing Charles today as a follow-up after he developed a shingle on his left leg. And how are you doing, Charles?
It's coming along. It's a little better, but it's still annoying. I know these things take a long time, but the cream you gave me, we're putting on 4 times a day, but it's still sore when we make the application of the cream. Other than that, I can't complain about it.
Yeah, I asked you to be part of the program because of 2 things. One, that you have shingle about 40 years ago, and where was that time?
In the rib cage.
Okay. And this time he's having shingle on the left leg, and we'll show you the lesion with his permission, so that we can see how atypical shingle can present. When it's in the rib cage, it's easier to pick up because we see the band shape eruption, but not in this case, it's rounded. And you say you went on the water this week.
Yeah.
And what happened?
Well, I've been swimming, doing my exercises, and that didn't bother, but I stupidly forgot and went into the hot tub one day, and that, I think, exasperated the situation and flared it up again.
Wow.
But I'm not doing it anymore, but it was better before I went into the hot tub, so there must be some little infection or something, I would imagine.
Right. It's what we call that superimposed infection, because the shingle, as we spoke in the program, is a viral infection. But what we're going to see on Charles is that he has now a superimposed bacterial infection on the skin. Why don't we take a look? So as we can see here, the lesions are healing beautifully. And when he went on the hot water, most likely got super infected with bacteria, and that's why we see the redness around it. And I can touch this because when I was younger, I have chicken pox, so it cannot be transmitted to me. Okay? Remember what we have said earlier in the program, that if you have shingle, you want to stay away from pregnant women and children that have not been exposed to chicken pox. Otherwise, it won't be transmitted. There's no infections to other person or nothing like that. But it's looking good. It's looking really well. He's responding well to the treatment, and we're going to continue with the same treatment that we have, except that we're going to add now some local antibiotic in the area so that we can stop this little superimposed infection on the shingle rash. It's more common, it's more common on the chest. About 50% of the cases, maybe a little bit more, appear on the thoracic, on the chest area.
Right.
Okay.
Rather than on the face.
Right, exactly.
Okay.
And then on the abdomen, and the face and the gluteus, that area.
Right.
And sometimes people will get it between the gluteus.
Right.
Because there is a little dermatome, doesn't spread too far.
Right.
So they get a little rash.
Right.
The key is, if you look in that, if you are able to look in that area, or you have somebody take a look for you, if that little rash between your gluteus is localized on one side, it can be shingle. That's what we call unilateral. If it's localized on one side, it can be shingle. Have somebody take a look within 48 hours.
If you can see it.
If
but
not,
even if you can't see it, mention it to your doctor and let your doctor examine you. If you have any doubts, the best way to treat this disease is to find it as soon as possible.
Find it as soon as possible, and you want to start treatment.
Right.
My threshold dropped to 1 day.
Wow.
I mean, most textbook will tell you 48 hours, but being a geriatrician, treating a lot of elderly patients, and even if I follow everything by the book, the only way I get good results is those patients that I catch early.
And the diseases move so quickly.
Absolutely.
Sometimes for the elderly. Now let's talk about treatment. So I go to you, and I'm elderly, and you find out that I have shingles. What would be the way that you would approach my case? And not merengue lessons either.
No merengue, no tango.
Medically.
Medical treatment. After we does a tango.
Okay, tango.
No, the first thing is that anybody over the age of 50, because you say elderly, a lot of us, gerontologists now is moving down from 65 to 50 because we want to be more preventive.
I see.
What we want to do, we want to practice more preventive.
You want to make me feel old today.
I want to make you feel geriatrics.
Yes.
Yeah, I want you to join my club. Okay? I can show you the dye I use for my hair. So you can. I'll share with you after the program. So,
are you having a good time?
people over the age of 50, you develop the disease, you want to see the doctor immediately.
Okay.
Okay? Because if you develop the complication, will be for the rest of your life.
Right.
So we're talking about blindness.
Right.
We're talking about loss of hearing. We're talking about dizziness.
Right.
We're talking about itchiness and pain on one area of your body for the rest of your life.
Okay.
So the complication can be devastating.
Okay.
So you need to see the doctor immediately so you can counteract those complications.
Right.
Now the treatment will vary. Not all shingle get treated the same way.
Correct.
If you have shingle on the on your trunk, on your body, your abdomen, your chest, it's one treatment. The dose of the same medication, name it a cyclovir or Fanvir, one of those pills, if you take it now for a facial shingle that affect the tip of the nose, that's called a Huntington sign. Okay. When they affect the tip of the nose, that means that the nerve that go to your eye is also have a high chance of being affected. Okay. Dr. London will talk about that. Right. When it affect this area, then the dose of the medication need to go higher. Right. And then what I do with most of the patients, when you come in the first time with the disease, I do a blood test, I check what is your renal status at that point. Right. Even if I know you for years, I will check renal status at that point, start medication, and you want to treat for a good 7 to 14 days. Okay. Okay. In my case, in my geriatric center, I see my patients usually within 5 to 7 days, just to see how they're doing with the treatment and how the rash is responding. Right. Because the rash, as it go through the immune system now, trying to bring everything back to normal, it will go from little papule, which is a raised area in the skin, then it will develop fluid underneath called vesicle, then it will develop pus, then it will have a little crust on top of it. And some patients, the top of the skin will become necrotic, it will become black, and it will look ugly. And I tell the patient, continue with the treatment, don't stop the treatment, because it's scary when you see that area. It's very scary. So I tell them continue with the treatment and just reassure the patient, see how they're doing. And I take the opportunity of those 5 to 7 days to decide how my next phase of treatment, if I'm going to go higher on the dose or if I'm going to come down. And really, it depends on the immune system. People with Hopkins disease, they are very prone to developing shingles. And when I send my patient to the cancer center here at Holy Cross, if they're getting radiation therapy, I watch them very closely, I educate them, and I'm sure we do that here at the cancer center, to keep an eye on their skin, because if you develop a rash while you're getting your radiation treatment for any kind of cancer, it most likely 90% or more of the chances that it will be shingle and you need treatment for that. So don't call the radiation oncologist to let them know you had a rash. Come running to your doctor and have your doctor take a look and start treatment for shingle.
That's very, very valuable information. Now, you said you began treatment, but you didn't say what do you treat it with. What type of medications do you use to treat shingles?
Usually a cyclovir is the treatment of choice. A cyclovir is a antiviral medication. There's another one called Fanvir that also came out that is very effective. I use it a lot. It gets clear and it doesn't damage the kidney too much. With that, I also use an ointment of a cyclovir. Now, some patients have come to me because you have developed the rash, you went to see another doctor, and the doctor gave you only the ointment. If you are over 50 years old, everybody should be treated with the pills plus the ointment. On top of that, because there is one of the complications that patient can have is called post-herpetic neuralgia, which is the painful area that remains despite the fact that the rash can be totally gone. You still have pain and a high level of sensation on that area. What I do to my patient, I put them on a high dose of prednisone. Now, prednisone, I know it has a bad rap in the community out there, and it is true. I try to avoid prednisone by all means, except with this case. This is one of the cases that I tell the patient it's a short course of the drug, and you're going to take it. It will not give you osteoporosis. It will not make your skin thin or anything like that.
Your blood sugar will go up, it will come
exactly,
down.
right. If you are a diabetic, it will, the sugar may go up during the treatment, but
but eventually you're going to feel all better.
Absolutely, because then we're going to fight with the prednisone. What we are doing is fighting that post-herpetic neuralgia, that complication that that we don't want. A lot of patients, if they do their complete treatment, they will go back to normal.
That's what I was going to ask
and
you.
That's
so
why we are
after about
here.
2 weeks or 3 weeks of treatment, if they follow all the directions and the course of the disease takes place, then you can be cleared.
You can be cleared, the rash will go, and you will have no sensory deficit or anything like that. You will be a totally normal person again if you get treatment early and if you get the right treatment. Don't let anybody talk you into just putting ointment because it's a skin rash. It needs to be treated systemically, meaning with pills, prednisone, and the ointment all together.
This is why it's so important that you go to a physician that knows all the medications that you're taking already.
Absolutely.
Because the cocktail of your medications can be upset very easily. So make sure that you're telling your doctor all the medications that you're on so that they can make a better evaluation and treatment plan. Now, we're going to take a little break right now, and we're going to come back, and we're going to talk about complications from this disease, as well as some other wonderful tips to all of our viewers. We'll be right back.
Mom, I'm a little worried about your upcoming hip surgery. How are you going to take care of yourself after you've been discharged from the hospital?
Well, I've already discussed that with my doctor, honey, and he recommended Holy Cross Home Health to help me recuperate at home.
Really? I didn't know Holy Cross provided such service.
Oh, yes. They've got doctors, nurses, physical therapists, occupational therapists, social workers, a whole group of professionals available if I need them.
Really?
Really.
Oh, Mom.
And seriously, they also have Nursing Network. That's a private agency that provides custodial care, help around the house, even an aide all day, 24 hours if I need her.
That's great. That means that you have a licensed nurse, a licensed therapist, a certified aide with a reputable agency that's going to be there to help you bathe, cook, and get around the house safely. I feel a lot better now.
Good. There's really nothing for you to worry about.
Welcome back. Our guest today is Dr. Mencia, and he's been taking us on an overview of shingles. Dr. Mencia, I have a couple of other things that I want to ask you, one of which is, say that I have something that develops on my lip, and most people say that's herpes. Does that have anything to do with shingles?
It's a cold, what we commonly known as a cold sore in the lip.
Cold sore.
Right.
Okay.
It is herpes. It is herpes simplex, a different type of infection. Mm-hmm. It gets treated also with a cyclovir, but that one can be treated with the ointment.
I see.
That one can be treated with the ointment. It is not shingle.
It's not.
It's a totally different disease.
Okay.
Okay, and it doesn't need a huge regimen. And usually it's localized. Now, I have seen the herpes simplex infection that will spread around the lips and still the same disease because it doesn't follow the whole dermatome that we spoke about.
Right.
So then that one get treated differently, less dose of a cyclovir if you want to give oral, and usually the ointment will work for that just fine.
And most of the times I hear people get stressed or they have been sick, and then that's why it gets named cold. Because it's usually because their immune system is down.
It's down.
So don't confuse it. It is not shingles.
Right. But both of them will get reactivated by decreasing the immune system.
And we thank Dr. Mencia for taking the time today to be here. We have learned so much from him, and I'm sure you will see him again and again because he is such a great presenter and a great physician. If you would like to invite Dr. Mencia to come to your club or your condo or your church, all you have to do is pick up the phone and call 954-776-3080. The public relations here at Holy Cross, they will make all the arrangements for you, and we'll bring Dr. Mencia and maybe a little snack for your group. And also, if you would like to purchase a copy of this video, it's available to you by calling the same number. If you would like to know how to get in touch with Dr. Mencia, call our physician referral line at 954-776-3223. And on behalf of all of us here at Holy Cross, I wish you good health.
Thank you.
We thank you for watching House Calls. At Holy Cross Hospital, we pledge ourselves to leadership in health education. If you'd like to receive more information regarding today's topic or to contact the physician featured, please call our physician referral line at 776-3223. Holy Cross Hospital. Expect great things.